and that is the most common way of spread. And these droplets, what happens is it just falls on the fomites. Fomites are like our table, chair, doorknobs, refrigerated doors, right? Anything. These are all known as the fomites, and these they fall on these fomites. And by the time we touch, and by accident we touch ourselves, our eyes, nose, mouth, etc., this virus enters into our body. So this is the most common way of spread of this virus. It is basically a droplet infection and the fomite borne disease. Now they say the virus also spreads through air, but yet we have to have a lot of data available for this. Now to Vivek, yes, we have known about what is coronavirus. We have known what are the ways it can spread. And the only query is, can children first of all be affected with this coronavirus? One. Two, what are they are getting affected, in what way they are different from adults. Three, there have been a lot of say about that children are mildly affected, children are not as affected when compared with adults. Is there any possible explanation for this? Could you please highlight on?
Very important question which Dr. Ganesh has asked. So answering to the first question, can children get affected by COVID? The answer is less. Like adults, children also do get affected with the virus, but the incidence of the infection is very less when compared to adults. So we don't see as much of children who get affected. Now, in what way are the symptoms going to differ from children and adults? Most of the symptoms are going to be essentially the same. The hallmark three symptoms which occurs commonly are fever, cough, and fast breathing. These are the three hallmark symptoms which worries any caregiver. Apart from this, headache, minimal running nose, or sore throat are the symptoms which can occur in children. However, there are some non-specific symptoms. Like we usually don't see these symptoms in, but we tend to see these symptoms in children. Now, what are these symptoms? Are sometimes they can be preceded by abdomen pain, vomiting, and diarrhea. So we categorize them as which are specific and common to adults, children, which are common to both, and symptoms which are usually not seen in adults. Third thing is why children are getting less affected when compared to adults. There are some proposed theories regarding this. The common thing is that children, you see, any caregiver would tell that on an average, a normal child will have around 6 to 8 respiratory infections like a minor cold in a year or so. Because of that cross reactivity with other viruses, which might also be some milder form of coronaviruses, the children are having cross protection with these viruses. That's why they're not getting more affected when compared to adults. Other thing is that you need a very good immune response to mount your response to an infection. Children, as they are very young, small children less than 2 years, their immunity is slowly developing. So an immune response is not just robust or adequate to show the full features of the disease. So these are the two important things which helps to differentiate from adults and why children are getting less affected when compared to adults.
Yeah, thank you, Vivek, for just explaining this. To basically sum up, yes, can children be affected? Children can be affected. Are like more or less similar to what we see in adults. Like they can have fever, cough, running nose, throat pain, etc. But do remember, children may be asymptomatic. That means what? Children may not have these symptoms at all. They may not have the signs of symptoms. I mean, their X-rays may be normal. In a house where an adult is infected, children without showing any symptoms of the disease can still be positive for the virus. Okay.
The next question, most important, is which I would like to ask Dr. Ganesh is, so what will you do if my child has symptoms? So what is the next step which you should take to make sure that you are giving the right care at the appropriate time? So what should you do, sir, if someone has a...
Yes. Suppose in a house, if a child has got symptoms of coronavirus disease like fever, cough, running nose, throat pain, sometimes vomiting and loose stools, etc., you have to consult your pediatrician, right? And they will examine the trial, and then they will decide whether this is just a viral infection or it is a probable or suspect coronavirus disease. And then they will order for testing only if it is needed. And it is always better to self-quarantine ourselves. Do not step out of the house for 14 days. Minor symptoms, you need not worry. The progressiveness of the symptoms, and then contact your doctor for your further advice.
Thank you, sir, for elaborating on what to do if a child has symptoms.
Yes, and as I said, though there are symptoms, what danger signs or symptoms that as a parent should worry. Suppose if your child is breathing fast for his or her age. Two, the older children, more than 10 years, if they complain of cough with chest pain. Three, if you notice the lips of your baby and the nail beds of your baby turning blue, then child is very irritable, or they appear to be lethargic, say they always prefer to sleep, etc. Their activity is less, their oral intake is less, then you have to consult your pediatrician immediately. And Vivek, suppose a child has got fever, cough, and is breathing fast. This will require a COVID testing in these days?
Very important question to be answered now. Like, see, when you're carrying a child and child has symptoms which matches with the symptoms of COVID. One point which I would like to tell, definitely please don't do a self-test. The rules are also that you need to have a prescription by a doctor when you need to test for COVID-19. So now, when you have such symptoms, you consult a doctor over the phone, and he would request the child to be visited for consultation. And how you can investigate such a child, if the doctor is also convinced that there are features suggestive of COVID. So there is a simple nasal swab test which is done, which does not cause any pain to the child, and the results of which will be available in 36 hours. Other things is, sometimes your doctor might also request you to undergo some blood tests and an X-ray. He feels that those are warranted at this point of time. So take home message is that nasal swab testing is available. Don't do and consult your doctor, who would request for an investigation if he feels so, if it is warranted at this time.
The thing is, panic should not be the reason to undergo testing. When you have features of a viral infection, please do consult your doctor and then proceed accordingly.
The next question is ask Dr. Ganesh. Now we're all taking care of our children at home. How to protect our kids and ourselves during this difficult times in order to contain the virus?
A month back, we were all very active. As we are all work, are going to school, daily routine is carried away. But in the last 1 month, the virus has almost brought down the world to a standstill. That's what I can say. So in this era, now the biggest thing is how one should get protected from us. Yes, that's all thing is, since there is no specific treatment for this viral infection, as goes the old days saying, prevention is always better than cure. So always protect ourselves. Now, how do we should protect? One, first follow the rules. That is indoors. Never ever step out of your house unless it is needed. That is number one. Two, practice social distancing. So do not jointly go together for buying anything. Or one family member can be allowed to step out of the house to go and purchase things. Whenever you go to a grocery shop or a vegetable shop or a fruit shop, please maintain the distance. It's our duty also to educate community people also about this, because most of them may not be aware of this, what is what. Whenever you step out of, please ensure the habit of wearing face masks. Masks, it helps you to protect yourself from infected. It also protects others from getting infected, right? So always use a face mask whenever you step out of your house. And three, for children more than 2 years of age, you can use face mask. Below 2 years, you need not use face mask because of the risk of infection. Four, Mask also should be worn by people who have got respiratory infection. For example, somebody in the house has got a fever or a cough and a cold. That may not be a coronavirus infection, but still to protect from giving the drop mode of spread, so you have to wear the face mask. Fourth is hand washing. Hand washing with soap and water, proper guidelines of following a proper way of washing your hands with soap and water, it removes virus from your body. And for those areas where you cannot use the soap and water for your hand washing, you can always use a alcohol based hand sanitizers. So that helps you to eradicate the virus from your hands. So these are the four things that we should follow at this point of time to protect ourselves from getting the disease.
The method by which we can adopt children with 20 seconds is the hand washing time. Anything we can do so that we can make it like a play activity for them.
So it is usually like how to this thing. One is they can be taught to sing a happy birthday song. Happy birthday to you. So when you sing this, at the end of 20 minutes, you can just wash your hands.
So,
And the next question is, Dr. Vivek, I think there are houses which have got kids of just born babies, kids of 2 months, 3 months age, kids of 10 months, 1 year of age, kids of 2 years and 10 years of age, right? And most of the parents have done the right immunizations rightly. Now, if the child's immunization date is due during this period, what parents should do? Should they proceed with vaccination or they should refrain themselves away from vaccination and they stay at home? What is your advice on this?
very important and pertinent question which is raised by Dr. Ganesh. With the lockout period almost extending to close to 40 days, now there are recommendations in, given as to how to proceed with our vaccination. If the Center for Disease Control guidelines mention that prioritization of newborn care and vaccination of children should proceed as planned till 24 months of age. The most important thing is for example, the vaccination which is initially due for the babies who are born at birth, the vaccines at 6 weeks, 10 weeks and 14 weeks, 6 months, 9 months be proceed as per your schedule, and routine vaccination should be continued. However, for optional vaccines and for children above 2 years of age, and in which you have only booster doses which are pending and which are non-emergent vaccines, you are always concerned prior to immunization. For whenever you have doubt for a smaller child whether to vaccinate or not, call your doctor and ask your doubts whether to proceed. The guidelines mention that you have to proceed till 1.5 to 2 years with the routine schedule. No need for deferring the schedule, because you do not want to end up in a situation where vaccine preventable diseases are re-emerging again while dealing with a pandemic like COVID-19.
So the take-home message is yes, children can be vaccinated safely, right?
Yes.
However, it has to be discussed with their pediatrician, and then parents can proceed accordingly.
Just want to ask an next question. Interesting question is to Dr. Ganesh. How do you effectively parent to tide over this crisis and period? All of us are locked down in our homes. Many work from home. Children are disrupted from their routine daily activities. How should we go about this?
So this is the most difficult thing that is faced by the families, especially during this period. On one side, if you look, every year the child had their holidays. The holidays usually extended from mid-April to mid-June, or from April and May. So depending upon the schools, whatever it is. But how this vacation is basically different from others. One, unlike in the years, what happens is people used to go out, they have got their own activities, schedules, etc. But now there is a there is a period of lockdown. That means you cannot step out of your house unless it is really indicated, right? So in this time, yes, it's very difficult to manage time both for the parents as well as for the children. So the one thing, yes, these are basically the guidelines from the UNICEF, etc. Spend more time with your kid. That is one thing. You have to allot time for them, right? This is the time for you to open up, for them to open up and spend their quality period of time. That is number one. Two will be so always keep talk to your children in a positive way instead of saying, hey, don't watch TV. Why you're constantly watching TV and irritating us? So instead of telling that way, what happens is we should always tell, see, please do not watch. We have got other activities. Now let us come. Why don't you involve yourself in doing these sort of activities? The older children, yes, you can always train them to do the household jobs. They can do small household jobs so that they know things. And that is one way, right? Three, and have a structured plan for the day. Though it is very difficult to maintain the structure, but still, yes, your daily working schedule can be like this. The moment they get up from the morning, they can do some form of exercise or yoga. This is all for older children. They can have their healthy breakfast, and then for 1 or 2 hours in a day, they can have their study time, which it need not be confined only to the textbooks, but it can be even a storybook, whatever it is. Then comes the lunch. All of us sit, have the family lunch together. Yes, this is one time, yes, for you all to sit and have a lunch, then have a small nap, again play activities and other activities, and then going for a bed. Yes, the biggest thing is the screen time. You can allow an hour or more apart from your regular this thing for children to view their screens, right? So this sort of structured program helps to prevent from they getting bored and you also being getting irritated. Okay, right? And avoid the other behavioral patterns, etc. Dr. Vivek, should the parent and kid wear a mask? It's always the rule, even when they're inside their home, or it is only when they move outside?
There is a very valid question because mask is one thing. With the lockdown and rules, everyone are requested to wear a mask. So how should we go with children? The recommendations are that now only children above 2 years of age should be given a mask. The reason for this, younger children might have suffocation and they may not be able to express their concerns. So children above 2 years of age are allowed to wear a mask when they step out of the house. As adults, any age group can wear a mask. The mask recommendations are what mask should I do? The main thing is that a cloth mask which can be easily made in the house with any cotton fabric, mainly with for example, a cotton t-shirt, which is well and good. We do not have routinely use surgical mask. We did not routinely use 3-layered surgical mask or the very famous N95 mask, which can be reserved for only healthcare professionals. The take-home points would like to stress is two things. Wear cloth mask. Children above 2 years can wear mask. Less than 2 years, don't give any mask to children. We have given a website here, cdc.government, and you can search how to make a mask at home itself. So if you have a stitching machine at home, it's more than enough. So all of us, there are 6 steps of how to go about in knitting a mask.
Yes, other thing what I want to add to him is, yes, it's good to see most of you wear face masks. It's a welcoming thing, but at the same time, it's quite disappointing also to see people wearing mask and then just lifting the mask in their neck, right? And so when they wear mask also, they touch the inner aspect, outer aspect, all those things. So this is all not to be practiced. So basically, when you have got a face mask, this is basically a 3-ply mask. You can see 1, 2, and 3. So this is basically a 3-ply surgical mask, right? And when you look carefully into this, it is green in color. The darker shade on one side and the lighter shade on the other side, basically. So whenever you are going to wear your face mask, it is like this. So you should always hold the mask like this. Do not touch the mask here. So it is always hold the mask like this And second thing is you just adjust yourself by touching the outer fleet. So do not touch inside, right? And when you put this, right, and then safely you can tie a knot, right? Then you can tie a knot like this. So a complete face mask, yes, it should not cover your eyes. It should be extending to the nose tip, and then you should cover up to your chin. So this is one way, right? And second thing, when you want to adjust, it is always from the outer aspect, don't adjust from the inner aspect. So basically it has got two layers. This part, it helps to repel the germs, and the inner portion, it helps to absorb the moisture. So this is how the face mask works. And when you remove also, you should remove it only like this, right? And then throw it safe, say, help for a safe disposal of the face mask, right? So this is the one way of this. And how long should I wear this mask? It is generally for 6 hours you can wear it, right? Or whenever it becomes wet, you have to remove and change your face mask. That is why we advise only when you wear mask, wear when you go outside, and only for those with severe respiratory infections, then you have to wear mask inside your house. And please just it is just for it, it is available. Please do not buy N95 mask and wear it unless it is recommended by your doctor. N95 masks are basically for healthcare workers who deal with sick patients in ICU, who do procedures, right? So for those sort of, and who see patients in the respiratory or fever clinic, they are supposed to wear that sort of masks. Okay, right.
Thanks a lot, Dr. Ganesh, on straining the importance of the different aspects of the mask.
And Dr. Vivek, yes, now we learned what is a coronavirus, what are the modes of spread, what are the disease manifestations, how to protect ourselves. In fact, we have also just shown how to wear a face mask. Now, kids are always at home, right? As it has been mentioned earlier, how to engage kids and not to go for a desperation. Now, certain children do insist, Appa, we have to go out and play. There are other kids in our apartment, right? Why don't we, why we cannot go out and play? What is your advice on this?
With all schools having a closure prematurely as well as preschools, now the problem is that children are kept in the house. Now the problem is when you have a playground and a play date, it may be situated within the same street, or it can also be within the in an apartment as well. But the thing is that you cannot impose our restrictions on social distancing to children. So it may be only your neighbor, but when we go out, there is no concept of social distancing among children, and it's very difficult to control 2-3 children who enjoy in a play. So number one, on this regard, we have told that to curb all playground or play dates temporarily till the restrictions on social distancing have been removed. Another thing is that when they go to a play area or a playground, you will have your jungle gym, your swing and all sorts of play activities there. The main concern is that, which Dr. Ganesh had told in the initial slides, are fomites. You need not know which person has these symptoms. They might have the virus embedded on any of these play areas. So the concern, another important concern is fomites here. So in order to avoid fomites, and as because you cannot practice social distancing among children, playgrounds and play dates needs to be currently dissolved. And once the situation is under control and social distancing norms have been removed, then can resume all such activities. Till such time, we can encourage indoor activities within the family itself.
Is it safe for children to play on the terrace, Dr. Vivek?
The only thing is younger children, I wouldn't advise going to the terrace. Any child who wants to go to the terrace should be under the supervision of a caregiver. The child should not go to the terrace alone, should not be left in isolation in the terrace, and it is only beyond 7 years of age that children can go to the terrace, and always be under the supervision of a caregiver.
Okay, thank you.
Next, which I would want to ask Dr. Ganesh is, we have many kids who have wheezing. My child has wheezing. There was a question raised by one of the mothers, and he's on inhalers. What precautions should we take in view of the current pandemic?
Precautions is as per the general precautions: following social distancing, wearing a face mask, right? Eating healthy food stuff, etc. Only thing is children can develop these, right? And the one thing is when they develop these, they have to use the inhalers as per their pediatrician's advice, right? And children with these may be prone for developing a coronavirus infection. Hence, all precautions has to be taken, right, as according to their doctor's advice. And the nebulizations which we normally give for these, generally if you go and ask your healthcare provider or the doctor, they may be saying it's better to save use a inhaler rather than the nebulizer, because nebulizers do generate droplets. That is the one thing. So, and when the child is on preventer therapy, yes, they have to take this therapy. They cannot stop it unless they are advised by their doctor based upon the thing.
So the take-home message is continue inhalers, avoid unnecessary nebulizations. Nebulizations, generally refrain from giving nebulizations. And important thing, in case of any breathing difficulty, in spite of the use of inhalers, get to the hospital immediately or call your caregiver.
And in this context, I would like to also address what amongst the children, which group should be extra precautious. The one is children who have got a heart problem. For example, children with a hole in their heart or the blue babies, right? Though they have to be extra careful. Children with kidney problems, those suffering from a nephrotic syndrome, or children with a renal failure who are all on dialysis, they should be extra cautious. Children who have got problems in their lung, as I said earlier, lungs and arteries, the children with wheezers, right? Children with the interstitial lung disease, they have to be extra cautious. Children with chronic liver disease, those who are having jaundice for a long period of time, those who underwent liver transplants, etc., they should be very, very careful. And infants, babies who are less than 1 year of age, they should be very, very careful. In addition to this, yes, children who are taking the steroid prescriptions for a long period of time, right? They should be very careful. And children with immunodeficiencies, that is, these children, they do suffer from frequent infections, so they should be very, very careful. And what is the risk of a child becoming infected due to COVID-19, Vivek?
All of us have a question in our mind. What is the chances of a child becoming infected? The main thing, the good thing is that children have a lesser incidence when compared to adults on the rate of getting infected. For example, if you see globally the situation, only 1 to 4% of the total cases globally constitute children. Another thing, in India, for example, our total pediatric cases would be only close to around 1 to 2.5%. Among these children, majority of them are only a minor disease. Among those infected, majority have only a minor disease. This is very reassuring. And another thing to get reassured is that among those who are having minor diseases, only few require hospital admissions. They end up getting hospitalized because it is little more than a minor infection. And very few, less than 1%, to be exact, only 0.5% of children require intensive care unit. Which is little more when compared to, it is more when compared in an adult. Adult intensive care rate admissions are more, children it is less than 0.5%. The youngest case in India, it can affect all age groups. The youngest case in India is from Mumbai. It's a 3-day-old child.
So in addition to this, yes, coronavirus doesn't spare anybody. So always be prepared. It can affect from newborn babies till old age people as we go warm to tall, right? It can affect any age group. That is number one. And two, adding on to this thing, we almost say a couple of days back, the statistics say about 32 children were affected in Tamil Nadu, and most of these infections were mild, right? And remember, as what Dr. Vivek said, yes, there can be a lot of children who do not have any manifestations of the disease. That means they do not have any symptoms of the disease. When you just do a testing on the, then they may turn out to be positive. And Vivek, you said about the children being affected, right? And you said coronavirus also has got a fever, cough, and cold. But if you look back, most of the children, almost every say about 6 to 7 times in a year they get their fever, cough and cold, etc. So in what way this coronavirus disease is different from the regular flu? Because last year, the previous year and etc., if the child has got a fever, cough and cold, the dog, when we have taken them to the doctor, they say it's a viral infection, flu-like symptoms, don't worry, it will resolve on its own. But this year, if you see, yes, these may be the manifestations of corona, right? So in what way this coronavirus disease, it is quite different from that of the regular flu, what we do see in children?
See, like many children get affected with cold. There are many viruses. Coronavirus is a group of viruses, but which the minor coronaviruses can also cause this common cold. But to remember, to be exact and to remember is that what we should take home is the common cold never causes a high grade fever or will never cause a difficulty in breathing. This is one way in which a caregiver can differentiate between a common cold and a flu or a corona-like illness or a COVID disease. So common cold, no significant fever or very mild fever, and there can never be a fast breathing. With regards to coronavirus and flu, the symptoms like flu means, I mean the swine flu. Both the symptoms can be a little overlapping. Both can have fever, cough, but the amount of fast breathing usually is more in coronavirus when compared to flu, which both the symptoms, however, can overlap with each other. They can both be body ache, sore throat, cough, fever, and fast breathing in both the symptoms. So we have a dilemma whether it's a routine swine flu, coronavirus, or a common cold. So common cold is no fast breathing and no significant fever, but flu and COVID have some symptoms which go together. So whenever you have a doubt whether this was a routine or this is not from the routine, you always call your caregiver or to seek more advice if you are unable to come to a decision on your own. Another thing is allergies. Allergies usually do not have any significant fever and they have itching, skin rashes, and usually do not have very fast breathing as a primary symptom unless it is very severe. So common cold, flu, coronavirus disease and allergies, these are the common respiratory symptoms which can confuse our mind at this point of time. Next question which I would like to ask.
I think we can answer this.
Yes, sir.
How to deal with stress? Yes. Really, children are, whether knowingly or unknowingly, they impart a lot of stress amongst the family members nowadays. Right? Basically, if you see, you cannot keep them home. So how to cope up with the stress? What is your tips to the parents who are watching this session today?
And I think the most important question has been raised by Dr. Ganesh. So all of us have stress. We generally tend to ignore that children do not have stress, but their routine is disrupted. So when their routine is disrupted, they tend to have stress. So how to, some common tips which I would give you is talk one-on-one with the child every day, and make sure what is the concern of the child. Don't tell everything about the virus to the child. Tell in good ways that this is going to end soon. Positive reinforcement is one such thing. Second thing is there are 62 social networking sites on paper today, if not more. I just read about it and got to know there are around 62 social networking sites. Refrain children from getting exposed to all these social networking sites. Social networking is only when we ourselves get disturbed. Children tend to hear about social networking, Facebook, FaceTime, YouTube, all those things, and can get stressed. So limit their time and restrict them on social networking sites. Another thing is do daily group activities, engage in a worksheet with them, and praise and reward for their good activities. Another thing is, see, children tend to be among friends. They are bored of seeing our faces every day. What we can do is, now with WhatsApp, you can utilize social media in a very engaging way. You can WhatsApp your friend's mom and ask both of them to get connected over video call, which is available. Eat right. There is no specific food restrictions. Eat right, eat healthy, have a good balanced diet, and engage in indoor play activities as a family so that they don't become couch potatoes. And for children in 10th and 12th and going to the higher classes, e-learning is one way. I think all parents and children are already doing that. just to reinforce. This is one of the times when hobbies can become passion and passions, and you can develop, and you might have a prodigy in your child. Like we see the picture of Master Lydian here.
So basically, to stress, yes, encourage the children to participate more in their activities, right? Let them draw, let them color, let them paint, right? Let them develop a hobby. They can then the hobby they can have a passion towards those hobbies eventually over a period of time, right? Let us not keep on telling them please study, please study, please study. Yes, study should be there. At the same time, there should be other activities.
Next question I would like to ask Dr. Ganesh. Should any caregiver, should I visit my doctor for minor illnesses? How, if because we are locked down, we have to produce the restrictions on travel. What are the options? How can we consult our caregivers? What should we? How should we go about this?
Minor illnesses like a nose block, a running nose, etc. You need not visit the doctor. You can call your pediatrician, tell them what you find abnormal in your baby, so that they can advise you over the phone. That is number one. Two, at the same time, you should not keep a sick child at home without consulting your doctor. That is also a bit dangerous thing. So the warning signs and symptoms, as you said earlier, like a high fever, something unusual in your child, like a irritability, or always preferring to lie down when the child doesn't take his or her food rightly, right? When you see a fast breathing, bluish discoloration, etc., these are the things that you should take the child immediately to the doctor. Now, third, yes, we also know as doctors and as parents, we do understand your concern, right? Suppose if you could not go to the hospital. Nowadays, most of the hospitals you see they are offering your telemedicine consult, right? It is basically you in your home, you just sit in your front of your laptop, switch on your camera, right? The hospital gives you their doctor services to come through your app. You can show your baby, you can discuss, etc. But still, if something is abnormal, you can always come to the hospital guidance. Okay, right? This telemedicine now it has become a sort of approved practice by our Medical Council of India, which basically governs all the doctors in our country to follow ethical based medicine. Okay, in this context, yes, we do also have our Hello Doctor consultation. You can just consult to us through our video call, right? We'll be able to help you to sort out your kids' issues, right? Um, and Vivek, is there any, having known all this, is there a vaccine that is available to prevent this problem? Like, for example, the regular flu, what we do have a flu shots, right? And for a regular other infections like typhoid or jaundice, hepatitis A, we do have vaccines to prevent this. In line with this, is there a vaccine that is available for this disease right away? Or you feel that these vaccines can be developed within a period of a year or so? What is your views on it?
Currently, vaccine trials are being under trial. There are phases in the vaccine development and implementation. So this picture which we put here is the first human volunteer from USA in Seattle. She is actually a techie who is from her, she human volunteered herself to undergo the vaccine trial testing. People were very grateful to her, and her comment at the end was she was telling that she was proud to be part of this trial. Currently, there is no FDA approved vaccine yet available to prevent COVID-19, but trial research is on. Case permanente, the picture which you see in Seattle and Washington, they are under the process. But usually the minimum time for a vaccine to get developed after the trials and approval is minimum period is 1 year, which can even take up to 2 to 3 years. So we are all hopeful that we will get vaccine in the future. But currently there is no FDA approved vaccine yet available to prevent this disease. Let's just ask a pertinent question to Dr. Ganesh. Sir, is there any specific treatment for COVID? What should we do when there is a person with what will doctors?
Suppose somebody is affected with the COVID, right? There is no definitive treatment available for this viral infection. Treatment is basically a supportive treatment. What do you mean by the supportive treatment? For example, if a child is not taking well, intake is less, we do admit and then we give fluids. 2, the child has got temperature, fever, then we do give paracetamol. 3, if the child has got cough and cold, we do give medicines to suppress the cough and cold. Suppose if the child is having difficulty in breathing, and when you look at the saturation in the room air is less, then we do administer oxygen. And the sick child will go into the ICU, and as they are managed according to the standard guidelines which are established by the WHO, ICMR, IAP, there are guidelines, various guidelines that are available, right? Based upon the standard treatment protocols, these children will be treated accordingly. Vivek, how to quarantine children who have suppose a child is um, in a family, right? Suppose that member is found to be positive for coronavirus disease. They have 2 kids. Now, how do we really quarantine this? What do you mean by the? Everybody now says about quarantine, right? I feel it's a newly developed term, or it has been evolved those for many days now. We are we are using it more frequently. So, what do you mean by the term quarantine, and how do we scientifically make ourselves quarantine?
Quarantine, the word originated in the 14th century. See, like you see in this picture, there was a disease called as plague many years ago. So ships which are coming to Venice in Italy, because of the outbreak of this disease known as plague, the ships were restricted to travel, and they were all put in one place with distancing. So for close to 40 days. So the Italians were the people who coined the term quarantine from their own language, Italian, which is called quaranta giorni, which means 40 days. This is how the origin of quarantine has happened. Now, how will you quarantine a child who has been in contact with a COVID positive individual? First thing is, the child should be quarantined with the mother, even if the mother is found to be COVID negative. Never quarantine a child with the grandparents, because people above 65 years of age, they are the vulnerable age group, and if they have comorbidities like
Hello, எங்க இருக்கீங்க?
if they have diabetes or hypertension, then you are putting the risk of the.
உங்களுக்கு வந்து சோலைப்பந்தர் தெரியுமா?
Third thing is,
சரி, சோலைப்பந்தர் தெரியும். அதுல சோலைப்பந்தர்ல மடம் இருக்குல்ல, ராகவேந்திரா மடம்.
So have never quarantine with a elderly person. Third thing is screen time. Now we usually are the ones who restrict screen times, doctors, pediatricians, but current recommendations is you can be a little relaxed on your screen time, like whatever the media, the television or a laptop. For example, you can relax your timing hours a bit for quarantined children, not on a routine basis. Third thing is eat healthy, balanced diet, and with no specific restrictions on any food. So these are the ways to quarantine. So 14 days is the quarantine period, and if you are asymptomatic, then your quarantine can be ended. Incidentally, looking back at the quarantine word, which means for around 40 days, our quarantine or the lockdown is also totally existing for close to around 40 days. The next question I would like to ask Dr. Ganesh. So, sir, for children, breastfeeding children, mothers who are feeding their kids, there are a lot of concerns whether this virus pass through the breast milk and affect children, newborn babies. What would be
scientifically? Yeah, there is not much of evidence to say that the viruses pass through the breast milk. But suppose a mom is infected, right, and she coughs or sneezes during the time she's feeding her baby, then there is a chance that the baby might get infected with this coronavirus disease. So whenever she has got this, she can take the precautions. For example, wearing a mask during breastfeeding her baby, that is number 1. 2, sometimes if the mom is infected and the baby needs a breastfeeding, she can express her breast milk and then give through somebody so that the baby can have his or her feed. Okay, but as for us, there is no evidence to say that the virus has been detected in the breast milk. And so these are the ways: expressing breast milk, donor milk, etc. That is depending upon the advice of their doctors, they can just follow the methods of feeding the babies. And Vivek, and they say very hot weather kills the virus. That's why even India doesn't have much of coronaviruses as of now. So, what is the temperature theory behind the transmission of this virus?
There are many theories regarding. One is the equator theory. Other one is called the temperature theory. Why there are presumed to be that the virus doesn't survive in hot temperature, but to date, whatever research and science has given information is that there is no such specific thing that kills the virus or very hot temperature kills the virus. They are all assumed theories. There are other viruses which happens only in winter. They are seasonal viruses, but there is no solid reason to prove that they cannot happen in summer, which goes the same with coronavirus as well. But with change of seasons, we are in summer, we are still having cases even in the last week. So this theory doesn't hold good to summarize. Only with time and with season change, we'll get to know whether there is any role between summer and hot climate and COVID viruses.
So, to sum up, what we have seen for today is one, we all knew it's a COVID is nothing but it's a coronavirus. This is two, it spreads through droplet infection and format. So we should be very, very careful. Three, children also have got the risk of getting infection as similar to adults, but predominantly they constitute a very small proportion of this. Four, there is no specific treatment for this disease available as of now. So the treatment is going to be only supportive. Five, a mom can breastfeed a baby safely and children should be kept only in their home. Six, the Taraka mantra for this to combat the problem of coronavirus, where we can succeed, we will become the warriors, will be like one, to follow the social distancing, two, staying indoors, following all the government protocols as and when issued. Three, any symptoms developing, contact your healthcare provider at the earliest. Four, hand washing and safe hand hygiene is most important, and wearing protective face masks. Right? I hope this summarizes about the coronavirus. Right? There are a few queries that has come to us from the parents, and thanks for your participation and the overwhelming response what we have received. And one of the parent has said, will there be a recording of the session available? I think marketing team will just coordinate with this. And can we give fruits to kid? Yes, you can give fruits to kid. There is nothing wrong, right? Nicely wash and give it, right? And what is the maximum temperature where virus can be killed? Vivek?
There is no specific, it not only depends on the temperature, the surface of this, where the virus is, the humidity of the relative humidity of the environment, all these takes into consideration how the virus is going to behave. It's not only the temperature alone, but the relative humidity on what surface which it is going to be there. On any routine survey, it can be even for a few days, it can be for a few hours, but there is no specific time period on how long they are going to survive on the surfaces.
Okay. And one of the parent has asked, my daughter is 10 months old and due for measles vaccine. Probably yes, you can come and have your vaccine. There is no contraindication for vaccine. And again, another mom has replied, 1.5-year-old child needs to be vaccinated with diphtheria, pertussis, and tetanus. Yes, I think this.
I think child would require the vaccination.
And so most of them have asked questions regarding vaccinations. Yes, vaccinations has to be given. There is no doubt about it. Yes, please contact your pediatricians. Yes, and then fix up an appointment, and then you can come and have the vaccine. Okay. And my daughter is 6 years old. How much of screen time can I allow her? One mom has.
The usual restriction on screen time is around an hour, 1.5 to 2 hours. So you can just relax it by an hour or more. Instead of watching 1.5, you can extend it to around 2.5 hours. It can be a little flexible from the routine norms.
And another mom has asked, can we use Dettol to neutralize the virus in clothes and other household things? Basically, what she means is, yes, while washing, put a Dettol and wash. Is that approved?
the mother, I think, is concerned about fomites. Fomites can be killed. Washing laundry can be given routinely. That should be enough. But with regards to fomites, cabinets, door handles, and mobiles, what the recommendation is that we need to use sodium hypochlorite solution to disinfect.
And one mom has asked, COVID-19 is slightly similar to flu, affecting the lungs and the respiratory system, basically. So will taking the flu shots boost the child's immunity?
The flu which the mom is talking about considers only to swine flu, which what we call as H1N1. This will only prevent or only help in it. It is only 50% effective. It does not protect against COVID-19. So the flu shot should be taken yearly, and it is only for swine flu, and it has no relation with COVID-19.
And last thing, is it safe to send kids to school in June? Yes, this depends upon the government rules and regulations. When the government lifts its norms, yes, and the school authorities do open their schools, considering all the safe and social distancing measures, you can send the child to school. I think that should not be a problem. And what kind of precaution do we need to follow prior sending the kids to school?
Precautions prior to sending kids to school is one thing you can do is you can make sure that once school is open, probably in some schools also they have started falling. The class teacher or can have a soap and water or a hand sanitizer which they can use under the supervision of the class teacher. And social distancing for older children could be practiced, but smaller children it is not. It could not be applicable. So probably classrooms, the grouping distancing could be made out in the classrooms. Hand sanitizers could be kept in the classrooms under the supervision. These are some of the things which could be followed in school.
Yes, for older children can be made to sit at a 1 meter distance away, right? They may be encouraged to wear face masks, right? And not to share water and other
fomites.
Yes, because there is a risk of fomite borne transmission. That those things they should avoid it. Is there any vaccine that we can administer to children as a precautionary measure?
Currently, less than 2 years, give your routine vaccinations. The primary vaccinations need not be postponed, but there is no approved vaccine as of now for COVID-19. It is just precautions and social distancing, wear a mask, and have a healthy environment and hand hygiene.
Yes, I think most of the other questions from the families are pertaining to vaccination. As we have said earlier, yes, it's safe to give vaccinations during this period of time. Yes, most of the hospitals, they do administer vaccines, and we also administer vaccines to all our patients. You can always contact your pediatricians, fix up an appointment, go get vaccinated. I think that should be the thing. And there is no vaccine per se for coronavirus as of now. I think if there are no more queries, we close the session. I sincerely we thank all the parents and their families who come to us, spend their time viewing the session. Thank you one and all.
Thank you. Thanks, sir.